Now I'm going to present one case study thanks to one of the leading consultant in India, Dr. Jayaraman. I have adopted from there itself. So he has a case where he lead the team for pesticide contamination. Few years before, it is somewhere 2015, 16 and 17 also, there was a huge mortality in the broiler feed broiler in northern part of the India, and it is irrespective to all breed, all feed, and mortality level was very high, and almost all organization their first thought goes, "Bhai, ye mycotoxin ka problem hai." But the problem was not mycotoxin, because when they see that report, when the feed sample sent to various lab, they found that aflatoxin is under control, slightly higher, but it is under control, means around 15 ppb or 16 ppb. And the study was done in the more than 5 or 6 labs. And okra was almost, it is the normal level. It means there was no mycotoxin problem. But at the same time, the organization, means your layer farm, broiler, they change the doses of mycotoxin. Means abhi hum 1 kg use kar rahe, maybe we can use to 2 kg or 1.5 kg, but problem was not solved. They changed the brand also from one company to another company, but problem was, because there is no problem of the mycotoxin. Second, they thought that it is a lychee disease, IBH. Because all the symptom which was appearing, it is leads to some suspicion that it is a problem of lychee, because liver is impacted higher side. Okay, so they did the molecular diagnostic, PCR test. Okay, after PCR analysis, they found that the PCR test is negative. This PCR band, which is for lychee disease, it is around 700 base pair. So that was almost nil, means in the means positive control, it is negative. So in that case, there was no success. Then as a practitioners or as a veterinarian, the laundry list of medicine applied, but problem was not solved. Problem was not solved. Then what? Suddenly they understood, there is some clue that after changing the feed, after some time, problem has reduced. There is a significant drop in the mortality due to change in the feed. Then they thought that why not again check the physical parameter of the corn. So one of their team members, they found that there is some smell of pesticide in corn itself. There is some smell of pesticide in the corn, and that was given the indication it could be the problem of pesticide. And they tested the feed further for the pesticide angle, and they found that the carbofuran level was 75 ppb. And what was the maximum residual limit? It is 10 ppb. So it was clearly indicated that the problem is not related with the mycotoxin. The problem was not related with the lychee disease or IBH. The problem was carbofuran, the pesticide. Right? And the lot of medicine applied without any further thoughts what could be the probable reason. So this is one of the case study which indicate that sometimes we think that problem is related something, but actually that is not the real problem. That's why when I told that when you are looking at the gut health, it should be 360. It is not only one component is the responsible. Then I took another study, thanks to Dr. Mujib Athar. He took the case of layer, breeder, and broiler, and he presented last year in one of the conference in Hyderabad, and he found that the level of there was a huge mortality as well as production loss in Telangana region. So this case study was adapted from Dr. Mujib Athar case. So these are the two cases which I wanted to highlight. Pesticide problem, it is a realistic problem. The problem which is actually impacting the farmer, and whether people are concerned about it not, it does not leave the space. It gives the harmful impact.